Hello there, and welcome to Unleash the Network podcast, a podcast that aims to educate and inspire our listeners by sharing stories from Mastercard Foundation scholars and African Leadership Academy alumni who have gone on to make a positive impact in their communities and promote values of leadership, innovation, and entrepreneurship. Johnson, thank you for joining me.
Thank you, Renatus, for giving me this opportunity to speak about what I'm doing, my progress, and what do I plan for the future. It's been a long journey and it's been challenging outside here. I remember being at ALA and the life being, you have all the resources you get. Then you get out of ALA, you have to, you're given the resources, but also you have to deliver. That's very important. And it's been a journey of delivering and just giving back to my community, which is what I wanted before. And yeah.
So, after graduating from ALA, you decided to take a gap year. Why was that? What inspired that decision?
So I honestly thought of taking a gap year, which was 2 months before graduating. So that was I was graduating in June, and I decided to take a gap year. It was around like April. Yeah. So, and the reason why I want to take a gap year is because I had this idea, and it's I've been thinking of, okay, when I go to college, then what's happening after college? Like, yeah. And what also I wanted to find myself to really, invest in my passion and what I do. So I had like 2 months to design a plan. I followed like multiple teachers, my counselors, my advisor, family, and everything to just help me figure things out. Because taking a gap year is not wrong, but something which is wrong is having an unplanned gap year. Yeah. So what matters a lot is you should have a planned gap year. If you have a planned gap year, your things will go smooth and well. So I had a planned gap year already. So I got back to my country having all these internships already organized for me, and I should just start working. And out of that, I just wanted to, do something meaningful, and invest in what I do, especially in healthcare systems and designing healthcare systems. Yeah.
And speaking about investing and designing healthcare systems, you have started Medipac. Can you tell us a bit
Yeah.
about that?
Yeah. So, so MedPack contains two words: med, which is medicine, and pack, which is like a box or package. This idea came, from we had this designed, boxes which were not very fancy. There's some boxes. One day we designed like some boxes, and we're designing like a package of like you can keep medicine inside and then give it to somebody else. It wasn't an idea of like, okay, we're delivering medications from one place to another, to just like, hey, maybe keep something else in the box, and how do we like deliver it to somebody else, or how do we give a gift to somebody else? So so we designed like a box which wasn't fancy, and we are thinking of like, okay, we can deliver healthcare and happiness at the same time. And MedPack started from there. So we because we believed in, and this idea came during like COVID-19, because now the amount of people going to hospital increased, and also like we wanted it to be safe. And the reasons why it's called healthcare is because if it's not safe, that's not care. So healthcare, because it has first to be safe. So we wanted to make a safe way for people to get their medications. Then that was just an idea. We had now to execute it. We started doing research and realized that 43% of prescribed medicine are out of stock. So people have to travel from one place to another,
Becomes a
searching the
struggle.
medications. Yeah. So just imagine the struggle, imagine the frustration, like losing time, the cost, and also like just to get the medication, which is a burden that no one has to bear.
And
So
sometimes you
we
can
then,
you can do
yeah,
all that and travel and still not get the medications that you want.
and yeah, and still not get the medication. So, and this didn't just stop there. Now we asked ourselves, okay, where are these people getting the medications? Which a direct answer is the pharmacy. Okay, now if they travel from one pharmacy to another getting the medications, and sometimes they don't even get it, what's the problem behind that? So we started now doing the research on the pharmacy area. We visited the pharmacies. We did a nice research, and we found out 12,000 pharmacies 12,000 pharmacies, they struggle with restocking their medications. Yeah, they struggle with the stocking their medications. So you find disease rates are rising, and also people are struggling to get their meaningful medications at the right time. You see,
And what
so
what
all that
causes
time getting
the pharmacies to struggle with getting their medications and restocking?
okay. So the struggle is the place that they get the medications, they have to travel around like 10 kilometers. Yeah. So they lose 10 to 15% of the revenue for just a 1 day of procurement. So you do a 1 day of procurement and you lose like 10 to 15% of the revenue. Just imagine the frustration. And they have to do this every time there is stock, you see. So now we came in as MedPack. Now this is the magic that happened. MedPack, we wanted first to, enable that pharmaceutical supply chain to be very smooth, because when you talk about MedPack is a part of a healthcare system. Healthcare systems are designed in a way to, manage people's health. And one of the healthcare system is the pharmaceutical industry. That's where we get in as a pharmaceutical industry to manage people's health. So the pharmaceutical industry wanted to, to make it safe for everybody to get their medications on time and a quick delivery. And for pharmacies also, we wanted to enable them to restock their medications on time without spending 10 to 15% of their revenue. So we designed MedPack for business and MedPack for customers. MedPack for customers, a person can order the medications on time, upload a prescription. If he or she doesn't have a prescriptions, he or she can request a prescription to the doctor. So we have a proper way. Somebody can request prescription from a doctor, and the doctor then responds and upload the prescriptions there. Also, you can refill your orders. You can put a dose reminder. You can schedule clinic times. You can also book your lab tests and book doctor consultations, which is very smooth. And we've been able to onboard 2,000 users up to now, with having around 167 chronic patients. When you come to the business part now, how do these pharmacies now restock their medications? We're enabling pharmacists to restock their medications, and a quick thing is, a pharmacy can have like a full stock, but also he or she can't manage the stock. Hence, the medications are expiring, and you cannot sell the expired medication to somebody else. Otherwise, you go to jail. So what happened is we're enabling pharmacists to manage the inventory, and we have a very good thing which is called the POS, whereby if a pharmacy owner sees that a certain medication is getting out of stock, he or she can put the medication on the market, and a pharmacy that's in need of the medication, at that point he or she can purchase it, and it's already solved, because now you won't let some medication to expire and somebody else needs it at the right time. So we have been able to onboard around 120 pharmacies right now in Tanzania, and we're working with them, and this has been very helpful and very impactful. Yeah.
I am pretty sure a lot of people listening to this have experienced firsthand going to a pharmacy and not getting the medication that you want, and then you have to go to like at least 5 other pharmacies and you still can't get the medication. And so this is a solution that a lot of us need, because we are actually suffering from this, and it's a big problem out there. And I like the fact that you're also trying to see how can you solve a challenge that both the patients and pharmacies have, right, in terms of medication and stocking and ensuring that orders flow smoothly. And so that's really amazing. I remember you used to love biology, and so it's good to see that you have extended that passion beyond school.
Yeah. I mean, just as when you talk about biology involves, various things. It involves you talk about biological systems, and one thing that most Tanzanians suffer, especially the youth, they overuse, or they don't know how to, they don't have a clear plan of how to use the medications, and which results to antimicrobial resistance. And also MedPack, we are very proud to also help that. We designed a very clear plan for you to use a medication, which will solve a bigger challenge that's affecting the youth to face this antimicrobial resistance. Yeah.
So for patients, is this an app that they're using, or is it just USSD code?
It's an app. It's an application that they use. So patients, caregivers, it's an application that they use.
So you can also track your medications and when you're supposed to be taking them and see what pharmacies have the medications you need.
Yeah, you track your medications. What also we give free healthcare tips to manage your healthcare journey. They're very free. Our own team, consisting of doctors, professional doctors, they design and they prepare these healthcare tips to manage your healthcare. And we are planning to also include a food system whereby to plan a good. We are planning to partner with other companies to to enable people to have like the proper diets aligning to their medications in the application.
So who are the other stakeholders apart from you and doctors and individuals who are working with you? Who are the other stakeholders involved?
Yeah, as I said, what we're doing involves the healthcare system. The healthcare system is very broad. Without patients, MedPack can't operate. Without doctors, MedPack can't operate. So we have a group of stakeholders involved. We have patients, we have the doctors, we also have the pharmaceutical industry in Tanzania, the manufacturers, the suppliers, yeah? Because now when you order a medication, we have now to deliver directly to your doorstep. Yeah. Now then, how do we deliver it? Apart from us having our own logistics, our own motorbikes, we then have to incorporate all these borders in town to enable this is also an employment opportunity for them to get into the application, also supply all these medications to people on time. So it's a wide range of people. We have the borders, we have the doctors, patients, the suppliers, the manufacturing industries in Tanzania, pharmaceutical manufacturing industry in Tanzania. So yeah.
And that's good because you also provide opportunities for other people in terms of employment.
Mm-hmm. Yeah.
As an entrepreneur, how has this experience of creating Medipac and working with the whole team of MedPack made you grow?
I've realized as the journey continues, entrepreneurship is not about just real talk. It's also about real work. So you have to work. You have to work 24/7.
You have to get the work done.
It's not an easy. Yeah, it's not an easy job. Yeah, I mean, when I got back to my country, immediately I graduated from ALA. I mean, we had all these ideas and everything together. How are we going to operate? How are we incorporating the systems and everything? But then I realized you have to whenever you do, you have to do something that will gonna work. You don't just design systems. How do you make sure that this system is helping the community that you serve? So I've grown enough to think of, okay, whatever I think, I have to put into actions, and the actions that I make, I have to look around who is benefiting from them. So as an entrepreneur, you don't just design systems. You design systems that they serve the community that you do. And other thing is, when we first launched MedPack, the first phase of application, we thought that was enough. But then now we realized that innovation does not stop. And as an entrepreneur, you also have to think of innovation does not stop. You have to keep on innovating. Because as you go on, the market changes, and when it changes, it disrupts everything. You have to sit down. Also, you have to keep on designing. So it's a job that you have to. It's a job that you keep on designing every day. Keep on designing every day. So I mean, I've grown enough, and even today, I can sit here and like tomorrow we're changing things, because I believe entrepreneurship is just about you innovating, keep on innovating. Yeah.
Yeah, they say you adapt or die, and innovation is really it's the key of entrepreneurship.
Yeah.
I mean, Johnson, I really love what you're doing, right? Because we all need to be healthy to do whatever it is that you're doing, right? Whether you're working, whether you're studying, whether you're playing, whatever it is, you really have to be healthy. And I'm glad that you're creating a solution that really helps every single person across the spectrum, really, right? Because everyone needs medication, right? And so that's a really good work that you're doing. I'm proud of you, and I'm really looking forward to you extending not only in regions in Tanzania, but beyond the country, right? To nearby countries, to Kenya, to Uganda, to Rwanda, Burundi, East Africa, right? And
Yeah.
I wish you luck, and I'm glad that you're also growing through the process, and you're also helping other people grow.
I mean, the funny thing is, so we just realized this. So we do weekly analysis in our company, and in every week whenever we do the weekly analysis, we find that also people that have ordered the medications are tourists. They're tourists, and I was this is very like it was very surprising, because I just thought I'm designing something that will serve the Tanzanians, but also like somebody get in a hotel. Of course, we have various flyers in the hotels, in big hotels in Tanzania, in hospitals. So you find most people, also people that order medications, include like 5 to 6 tourists that are doing so, which is something that's very great, and they're seeing what we're doing. And for me, it's something that it makes like to keep me like more innovating. And honestly, they also give feedback that's very, also to think about whatever you're innovating here, to also think help, also check about other pharmaceutical startups that are outside of the country. So we have big examples outside Tanzania, for example, like M Pharma, which is doing a great job, which is also like an inspiration to the market. Yeah, so we keep on innovating every day.
Yeah, couldn't agree more. We keep on innovating every day. Johnson, thank you so much. It was good catching up with you.